Does hyaluronidase also dissolve natural hyaluronic acid?
I see a lot of people who come in dissatisfied with hyaluronic acid filler placement performed by other practitioners, including both physicians and non-physicians. I'm often told that the patient had received several hyaluronidase injections and that they still didn't look better. They report that the practitioner was intentionally being conservative when dissolving the hyaluronic acid filler in order to avoid having the patient look worse because of the hyaluronidase potentially affecting the naturally occurring hyaluronic acids in the body. I'll discuss how I use hyaluronidase in my practice to help people who come in with problems after hyaluronic acid filler placement. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I use hyaluronic acid fillers extensively in my practice. I use these fillers to enhance the volume of the lips, cheeks, chin, jawline, and to treat hollowing under the eyes. I also treat lines, acne scars, and wrinkles throughout the face. I regularly use hyaluronic acid with platelet-rich plasma to improve skin quality in the face, neck, and décolleté with a procedure called skin boosting. I also see a lot of people who come in after being treated elsewhere and who need their hyaluronic acid filler dissolved as soon as possible. So I use a lot of hyaluronidase in my practice. This concern about the potential loss of natural hyaluronic acid in the body can be put into perspective when you understand where your natural hyaluronic acid actually exists. Further, if there is an indication for needing hyaluronidase, it's usually for a situation which needs urgent and definitive action. I see a lot of patients who had hyaluronic acid filler placed under the eyes and cheeks which needs to be dissolved. This can be an indication that the filler is present just below the skin, the muscle, and even the space behind the structure called the orbital septum. The space behind the septum is where the under-eye fat pockets are and is referred to as the orbit. This is also the same anatomic space occupied by the eye. I often see placement of filler to camouflage under-eye bags actually caused the under-eye bags to appear even larger. All these levels of tissue where the hyaluronic acid has ended up requires, in my opinion, experience and familiarity with this anatomy that a surgeon like myself is comfortable with. In fact, long before the hyaluronic acid fillers were introduced, hyaluronidase was used in ophthalmology for the purpose of improving the absorption of local anesthetic behind the eye before eye surgery or cataract surgery. I routinely perform displacement of anesthetic with hyaluronidase before cataract surgery using blunt needles. This technique is called retrobulbar injection. Needless to say, this required a very good understanding of the anatomy of the delicate structures in a very small space where the optic nerve and other important eye structures exist. Since I perform a lot of eyelid surgery, the spaces around the eyes are very familiar to me. I work with precision when placing hyaluronidase for the purpose of dissolving the hyaluronic acid filler with consistent success. I have found that being a surgeon has been very useful in both placement of hyaluronic acid filler as well as the dissolving of the hyaluronic acid with hyaluronidase. It all comes down to the level of experience with this anatomy. So when looking at a situation of problematic filler placement, we have the conceptual issue of native hyaluronic acid loss and the pressing situation of an unhappy individual who often takes days off work because they don't like the way they look. I address this often emotionally charged issue by performing conservative and precise placement of hyaluronidase. These patients are relieved and generally happy with their outcome without any complaint about their appearance as a result of the hyaluronidase treatment. In conclusion, although hyaluronic acid native to the area that needs to be treated may be affected, in my clinical experience, this is less important than dissolving the hyaluronic acid responsible for an undesirable outcome. I hope you found this information helpful. Thank you for your question.